Dumelang, and welcome to Mommy Diaries, the show we know it's all about parenting, motherhood, and this amazing journey ya hudisa bana ba rona. On today's show, we have Dr. Bongi. She's a developmental pediatrician. Did I say it right?
Yes, you did.
How are you, Doctor?
I'm good, thanks, and you?
I'm good.
Yeah.
Welcome.
Thank you very much.
I know it's just a few days. How's 2025 so far?
It's actually been good. I'm still on leave, so not yet back at work.
Yeah, I want to know are you still relaxing?
Yeah, but Monday.
Yeah. So today we're talking about a topic that I knew nothing about, autism.
Mm-hmm.
And, social media has made it easier for us to learn some of the things because we see mothers sharing their journey about autism. Now we know there's Autism Awareness Month and all of that. What is autism?
So it's actually quite a complex thing, but just to define it, it's a neurodevelopmental condition, meaning that the condition starts during development, right? So the child is born actually with it, but you'll only see it when they start developing. So it's a condition that affects two main areas. The one area is socialization and communication.
Okay.
And then the other is that they have restricted repetitive behaviors. So these are behaviors where they'll repeat certain things, have certain movements that they repeat, and then they'll have restricted interests. They only like certain things done a certain way at a certain time, or they can be fixated on certain things, or they can have sensory abnormalities where they're hyper, which is a lot, sensitive to certain things, which could be sound, vision, it could be taste, it could be touch. So any of your five senses can be affected. And that essentially is the definition of what autism is. But to put it in layman's terms, it's a developmental condition that affects how a child socializes and how a child communicates. It's not a mental condition.
Okay.
It's a developmental condition. It's not an intellectual condition. It's a developmental condition. The intellect or the intelligence of the child is on a spectrum, just like we have it with all humans. Some people are clever, some people are not clever. So those with autism will fall on a spectrum when it comes to their intellect.
And then in terms of diagnosis, like how do you know as a parent or as a mom or dad that your child has autism?
So it's difficult, but mothers will usually suspect it in the first year or second year of the child's life, where sometimes they may not respond to their name when they're being called. They may not show eye contact. So, when you call Tabo, and then Tabo will look.
Yeah.
Usually by about 6 months, a child knows their name and they'll respond to their name. They'll turn towards the caregiver. But with some individuals with autism, that doesn't happen. That joint attention, that looking when someone calls you. And then they can also present, not all of them, some of them with speech delays, where what happens is when speech is supposed to start, it doesn't start normally. So in the first year of life, around 12 months, you start saying your first words, mama, papa, but children with autism may be delayed in that process. Some of them may start with the words, and then in the second year of life, lose those words and become nonverbal. But there are others as well who can have normal speech development. So it's a spectrum, meaning one child with autism is not the same as another child. They each have their own difficulties, but the mom will usually suspect it with that speech delay.
Yeah.
That's when they'll really come and seek help, because you've got a 2-year-old who's not communicating like another 2-year-old. They may not even point when they want things. They'll take your hand and show you, or they'll push you towards
the direction,
what they want, but they won't use the words, or they won't communicate like children their age.
And are there kids that have that are delayed in speech but not necessarily have autism?
Yes. So you can have speech delay that is not autism.
Okay.
So when you're seeking help because you are suspecting that your child has got speech delay or that they may have autism, that's the one thing the doctor needs to try and separate out. is this autism? Is this an isolated speech delay? Is this a hearing problem? Because if you have hearing impairment as well, then your speech won't develop normally. So before we even make that diagnosis, we've got to rule out all the other causes of maybe it's a hearing problem, maybe it's a speech problem, and then we look at a cluster of symptoms. And in terms of diagnosis for the doctor, we use the DSM-5, which is a diagnostic statistical manual.
Okay.
And it's got criteria that the child needs to meet in order for us to make the diagnosis. We look at the history, we look at the development, how the child has developed. And then there are some other tests that can be done. Unfortunately, there's no diagnostic test on its own that can absolutely prove autism. I can't take a blood test. And say, yay, you've got autism.
Yeah.
So it's a developmental assessment, looking at how the child develops, and then I can use other tools. So there are standardized developmental tests that are there that we can use. Some of them are questionnaires. Some of them are observations where we'll watch the child and how they interact in a certain environment, like the ADOS, an Autism Diagnostic Observation Schedule, which is done by a qualified person, and that person must have gone through training in order to be able to use some of these tools to diagnose autism. So it is a process, and it can be a long diagnostic journey, because for me, it takes about an hour and a half interacting with the parents just to get a history about the child. And then I'll observe the child, and then I may request certain tests, and then I'll give feedback about what those tests have said and what we found and the criteria to see if the child meets the diagnostic criteria for autism. So it's not a simple.
It's a journey.
But
now, as you say it, I'm just sitting here thinking about someone back at home, or they can afford certain things. Because I've taken my daughter to speech therapists. They're not cheap. You know what I mean? For someone who's not working, or for someone their child is raised by Kukoko High.
Yes.
You know, like, do they get these things? Are they able to, are there such access? Yes, access.
So, I work in the government system.
Okay.
I work at Baragwanath Hospital, and I run the developmental clinic there. There aren't many doctors that do this in South Africa and the world at large, actually. It's very few doctors. And so the waiting list is very long.
Oh.
So to come and see me at Bara, you bring your referral form, you'll only see me a year later. We have a 1-year waiting list, and I have some experience in private as well. Private, you're looking at about a 3-month to 6-month wait, depending on how in demand that doctor is. But for a mom, as you say, who's there, as soon as they suspect that this child's speech is not normal, or their behavior is a little not quite like other children, then what they should do is present to the local clinic. So at the local clinic, the nurse will then see the child, and if there is speech concern, they can refer to speech therapy or occupational therapy, because for that, you don't need a diagnosis.
Okay.
As long as there's delay in speech or you're not speaking, you can go and see the speech therapist in public. We do have speech therapists in public, and then they will also refer you to a developmental clinic. So we've got 9 provinces, but unfortunately not all provinces have access. It's usually Western Cape, Gauteng, KZN, Free State that have these doctors. Some provinces are jumping on the bandwagon, so we're training more doctors there. So the waiting lists are long in public. And then in private, it's also expensive. I mean, it's not your usual 20-minute consultation with a pediatrician. It's an hour and a half. So for that doctor, it's also they're taking a lot of time to see this child. So we need to raise awareness, and we need more doctors trained, and have more people know and understand the condition.
And what's the difference between the speech therapist and the occupational therapist?
So speech therapy deals with any speech, communication, and feeding problem. So if there are those, they will assist. If your child has a stutter or a lisp, or, they can get referred to speech therapy. Occupational therapy is about assisting you with your functional daily living activities. So we use our fine motor, small muscles of the hand to zip up, tie buttons, brush teeth, to write. So they will assist you with those if you have trouble with such things. And then the physiotherapists, they will work on big muscles. So your big muscles, your movement, running, jumping, all of that. I am not boxing them because I'm sure they'll say, that's not all we do.
Yeah,
they do a lot more, but those are just the things they can work on. Yeah.
And at what age should a parent take their child to go for the diagnosis?
As soon as you have the suspicion. So we have a diagnostic lag where a mother will suspect my child, there's something not right with the speech, or I suspect autism, but it's usually about a 2-year lag until they get a diagnosis, because they'll be shifted from pillar to post. They'll go to see a speech therapist, a psychiatrist, a neurologist, a pediatrician, and all of them, no one will make that diagnosis. And it's such a long waiting list. But as soon as you suspect it, even at a year and a half, bring that child in for assessment, because the earlier they get the diagnosis, the earlier we can start intervention, and the intervention actually helps. It works. Early intervention improves outcome.
And is there any genetics that are involved? Is it possible that maybe a child has autism because kohai tatemoholo had it?
So the causes of autism is also quite big and complex, but there are genetic causes, and it tends to run in families. So you can find that there's either speech delay, or in the old days also, people didn't go for these diagnoses. So you may have had a malome who wasn't speaking but was very good at this, or, mate's mumu, or this one didn't go to school for whatever reason. So we always ask the family history, because there are genetic causes. Some of the genetic causes are known genetic conditions. So children with Down syndrome have a higher risk of having autism. Children with other conditions, genetic conditions like tuberous sclerosis, they have a higher autism risk. Children with Fragile X. There's so many conditions that I can label and name under genetic causes of autism. Some of them, though, are genetic causes where it's not an identified condition, but when we do the genetic test, the DNA will come back and show that there is something in the DNA that's causing that. So there's certain genes that can be associated with autism. It's not a lot, and it's very expensive to do the genetic testing. And unless your child has got other features of something, any other systems that are involved, maybe they've got certain birthmarks, or they've got a heart condition, or they look slightly funny, their head is bigger or smaller, or their delay is so severe, then those are the children we'll probably send for genetic testing. But technically we should send all of them. It's just, we're in Africa, resources are poor. We'd rather focus on the intervention, making sure the child gets treatment, management that will help.
Now, finding the right school for a child who has autism, I can only imagine finding school in general is not easy. So I'm sure when you say it, I'm sure there are kids we went to school with who had autism, but we didn't know. And the guys see, hey, what's really? Like there's so many things.
So
the stigma around autism, and we did not know.
We did not know. That is true. As I said before, their intellectual capacity falls on the spectrum. From mild to moderate to severe to profound. So there are those who are extremely intelligent. I mean, I have patients who will tell me the 8th of July, 1947 was a Thursday. And I'll be like, what? I'm going back in my calendar. They just know that, or they're very good at maths, or very good at reading. At 3 years, the child is reading. So you do get those. There are a few of those that have, and then you get the ones who also struggle. where at 8, 9, you're still struggling with potty training. They can't feed themselves well. So the school depends on the child's abilities. Right. So in terms of schools, we've got mainstream school, which is what everyone or the typically developing child will attend. And then we have special schools. But in the special schools, we also have demarcations. You've got schools where you have a remedial school. These are for the children who technically have normal intellect, and then they struggle either with reading, or they struggle with writing, or they struggle with maths. So if you give those kids a little bit of extra support, they can do the mainstream curriculum. And then you get the special schools where it depends whether you're mild intellectual impairment, moderate intellectual impairment, or severe intellectual impairment. So with each of those, they have a level. So if you are mild, they'll probably be able to get you up to about a grade 6 to 8 level. And you could probably learn some skills. I won't mention the skills, but working with your hands, jobs where you can be employable even without your matric, or be able to learn a certain skill. And then the moderates, it's more looking after yourself. So being self-sufficient. I can bath myself. I can, make myself a meal, but I struggle. I can't really learn a skill. And then you get the severe, where it's more stimulation. These are the kids who can't potty train, who struggle with talking or letting their needs be known, but then you have someone who'll care for them and stimulate them. So there's different types of schools. And I think once you understand the level that your child is at, then we can direct it in terms of which school we need. But we have a problem that our education system, and especially the public system, it's trying to cater for kids with autism. And the problem is with kids with autism, they don't all need special schools or special schools that cater for severe impairment. Some of them need some support. They can learn a skill. So they've tried to build autism-specific schools and then provide therapy, speech therapy, occupational therapy at these schools. They do exist, but the waiting list to get into the schools is very long. Yeah, and with the diagnostic process taking so long, when the children present to us at 6 or 7, they only get accepted in the school at 8 or 9. So that they've spent 2 to 3 years. So we really want to diagnose them early so that they can start at 6 to 7 in that environment if we can diagnose them early. And then the other schools, they don't cater for children with autism. But our education system is saying schools now, they're called supportive schools, where they'll have the therapy there, but they're mixing the kids, those with intellectual disability, those with autism, those with ADHD, those where it makes it difficult in the classroom setting to manage.
I can imagine.
All of them, we don't have the resources. And worldwide, I mean, they have inclusive schools where it's mainstream, but then they have teachers or support staff who will support that child in however they need to learn, but we don't have that here. And then private schools are just very expensive. Very expensive. They say having one child with autism is like having 6 children. Yeah. So your school fees, you can times by 6. That's the school fees of a child with autism, and all the therapy and the medical treatment and the doctor's visit. So it is a lot and can be a lot.
Would homeschooling work for a child that has autism?
So it is an option for some of these kids, and some of the parents do opt to take on homeschooling. It's good. It does work in terms of getting the child to do mainstream curriculum. But remember, these kids also struggle with socialization. So now you're keeping them at home, you're isolating them, they're not interacting with other kids as much. So if you're going to do that, then you've got to also bring up the social side so that they can play dates, so they can interact and get used to society and its social norms. So,
and when you spoke about spectrums, can a child have autism and ADHD? What is ADHD?
So ADHD is attention deficit hyperactivity disorder. So yes, a child with autism can have what we call co-occurring conditions. So it's very unlikely that you'll have just autism. You'll usually have autism, and then you can have other neurodevelopmental conditions like ADHD. So they can be very hyperactive, or they can have autism with sleep disturbance, where they struggle with sleep. They go to sleep at 2 a.m. or at 4 a.m. or they don't sleep at normal hours, or they take forever to fall asleep. They can have eating difficulties. They can have sensory issues. So these are all the co-occurring conditions. And sometimes that's what you need to manage, where the autism is maybe not the biggest thing that the child is struggling with. It's more the other conditions. They can have learning disabilities where the child can read but can't do maths, or they can do maths but they can't read. So they can have those difficulties, and it's about supporting the difficulties to optimize their potential once you've identified what those difficulties are. So it's complex, and parents come in crying because they really would like help for their child. And there's so many roadblocks, and a lot of people don't know about autism. They don't understand it. You know, parents are even scared to go to church because they're like, my child doesn't still. They run up and down, or the sounds, they want to join the music guys, or, you know, so it becomes, they also socially isolate. But we shouldn't. We should try and get them involved. Their brain works slightly differently to ours, and we need to understand them and teach them in a way that they learn. And accept them. Yeah, you're right.
And what support? I mean, like you're saying, parents, I can only imagine being a mom to I don't want to say a normal child, but what can I, just a child? Is a lot of work.
It's a lot of work.
Now, being a parent to a child that has autism, I can imagine. What support? Like, for example, you would find, even with our parents, you'd find, let's say you have a child with autism. Hi, I don't think there's anything wrong. And then you're like, no.
This is more than that.
It's more than that. Because our parents also don't understand it. Like, you know, when my daughter had a speech delay, my mom was like, of course, you know,
so it is. It's about raising awareness that these conditions do exist, and they're not conditions of now. They've existed before. We just didn't have the terminology. Even developmental pediatrics, it's a fairly newish division of pediatrics. It's been there, but just not as well known, and that's why we also don't have that many doctors. But in terms of support, there are parent support groups that are out there. There are Facebook support groups. There's mothers of children with autism. There are ASD parent support groups. And then we also have public groups that raise awareness for autism. There's Autism South Africa. There's the Ernie Els Center, because Ernie Els also has a child with autism, and so he established a foundation. So you can go and find all these support groups, and they're very good for the parents. Even at our hospital, we don't have a recognized support group. But whenever we have our clinics, while the parents are waiting outside, they exchange information about schools. They exchange information about potty training, about what worked for them when their child would have this or have that. And that's something you can't get from a doctor. You know, that's someone who's lived through the experience and has got evidence and says, this worked for me. I'm not sure if it'll work for you, but hey, give it a try. You know, so teaching everyone about autism is very important. And once they understand and learn from their own child, it makes a world of difference. But the support groups are there. There are support groups.
And how can parents continue to educate themselves? You know, you as a parent, you have to know and do your research and ask. How can a parent educate themselves about the condition that their child has?
So, yes, there are websites that you can look at. I'm not saying the internet is all good, because not all of it is evidence-based or good for your child, but we live in 2025. Information is there. It's accessible. Now, trying to figure out which is the right information is a little bit difficult. But if you're looking for things like Autism South Africa or Autism Resources South Africa, these are websites where you can get information on autism. You can go to WHO as well to look for these, to look for information. And schools usually have awareness days where the parents come in and they actually teach them, so that whatever, let's say, skill they're teaching the child, if the child is learning sign language, and not because I can't hear, but because I'm not speaking, at least if I can sign, then you will understand me. So there are certain ways of communication that they teach at the schools, that they teach to the parents, so that whatever the child's learning in school can also be applied at home. So there are awareness days. April is Autism Awareness Month. So information is flooded. Podcasts like these also make a big difference. So it's about raising awareness.
And is there medication? Like, sometimes when you have a certain condition, they can be like, oh, there's medication just to, not to cure, but just to help with certain things. Is there medication that a child can be on to help them with autism?
So I would love to have a cure and a medication for autism. But because it's such a complex medical condition, it's difficult to have medication. So there's no medication that will work to change the autism. What the medication does, it works to help with some of the symptoms that you can have. So if a child has got a lot of aggressive behaviors or self-injurious behaviors where they're repetitively hitting themselves or they can't sleep, then there's medication to assist with that. But it's not going to solve the underlying problem of the autism. So treatment when it comes to medication depends on what the child is presenting with, but the only FDA approved medication is risperidone or aripiprazole. And these are antipsychotic medications, which in children work slightly differently to adults, but they do help with some of the behaviors.
And the behavior and then the social skills, like how can parents, help their kids? Because you did mention that let's not close them inside the house. Let's go anywhere with them.
Let's go.
But when they start doing that, maybe around people who don't understand that, what can we do as parents
to
help?
It's important to understand what the behavior is communicating. Because remember, they have difficulties with communication. So sometimes the behavior is actually to communicate something. I don't like what this is making me feel. I don't like the feel of the clothes. They have a tantrum or whatever. So try and avoid those behaviors. The other thing is children with autism are visual learners. So not necessarily auditory learners. You and I are auditory. We can listen and learn. They may struggle with that. But when they see something, they'll know how to work it. Some of them are so good that they see you type a password once, they've got it because they've seen the pattern and then they can unlock a phone. So if you want to teach them, you can use visual aids or show them this is how we do it. I always tell parents, teach them how to make their own snack. Whatever it is, take them to the kitchen at 5, 6. They must know how to butter bread, put it together, pour some juice, sit down. Then when they're hungry, they're not going to have a big tantrum. You just put out their snacks and teach them they can learn. They have the capacity to learn. You just need to be patient with them. And they're visual learners, so show them, don't tell them. Show them and repetitively repeat it. They'll learn. They have a lot of potential.
Let's go back to just work at the symptoms, like few symptoms that you can say, these are the symptoms that you need to look out for.
So the symptoms that you need to look out for, as I said, the one is not responding to their name, right? Repetitive speech. Sometimes instead of saying, hello, how are you? They will repeat what the other person says and they'll also say, hello, how are you? Instead of responding. That's called echolalia. So they repeat what other people are saying, not having back and forth conversation. They can have repetitive behaviors, whether it's hand flapping, clicking, or have an attachment to certain objects because it stimulates whatever sensory thing, blocking their ears to certain loud sounds, walking on their toes, not liking certain things in terms of the way clothes feel. So they want to be barefoot all the time, or actually always wanting to have clothes on because their sensory things are different. Looking out of the side of their eye when they're looking at something, spinning things, not playing with toys appropriately. They don't have, or they struggle with imaginative play. So that a doll can be a real baby or whatever. They may use the doll for something else. Or the wheels of a car, instead of pushing the car, they're just spinning the wheels. So all of that can be. And then an aversion to certain foods, tastes, textures, smells. All of that are the symptoms that you need to kind of worry about.
And lastly, what advice do you have for moms who have children by autism?
So the one thing is, if you suspect it, go get help. There is help out there. Yes, there's a long waiting period, but in the end, it's worth it. You will get the help. And these children have a lot of potential. We have to assume potential. We have to assume competence because they can be taught, they can learn, they can be integrated into society. So don't give up on them. Don't put them in the box. Don't hide them away. Go and seek help. There is help.
And how can family members, because we know we raise our children with our family members, how can they support parents who are going through that? I'm sure it also tests marriages.
It tests marriages, it tests relationships, it tests it's broken a lot of those as well. But it's about advocacy. Advocate for your child. Tell them that, I swear, we don't need to go and have a traditional ceremony. This is the diagnosis. This is what we need to do, and help me. Look, it's working. It makes a difference. Now I know when he does this, what it means. Or when he does that, this is what it means. So other families need to also go and educate themselves. Go get more information. Go and find out so that you can support these children.
Because autism has if they are diagnosed with autism, it is autism.
It is autism. It's a medical condition.
It's a medical condition.
It's a medical condition. We need to learn, accept.
Absolutely. Thank you so much, Doctor.
Thank you very much.
Thank you. Thank you so much for watching, and thank you so much, Doctor, for creating that awareness and teaching us about, especially me, I didn't know much about autism.
Thank you very much.
Thanks for watching.